we are asking, has the NHS let down generations of gender-confused children? Give us a call on 0344 499 1000, or you can text us, write talk at the beginning of your message and send it to 87222, or you can tweet us on X at TalkTV.
Now, as we were just saying, a damning new report has found that children seeking gender care on the NHS have been let down by a lack of research and evidence. The report, led by retired paediatrician Dr Hilary Cass, found no good evidence for puberty blockers to adolescents. It warned that the toxicity surrounding the trans debate had influenced doctors and their decisions.
The report also claimed that mental health conditions could be confused for gender-related distress, and Dr Cass found that there is remarkably weak evidence for many of the gender treatments currently provided. Well, NHS England has said it is reviewing the report's finding and has instructed clinics to pause first-time appointments for under 18s. We're still joined in the studio by Isabel Oakeshott. That's my question here. I mean, this is not the first time that the truth about what we've been doing to, or what the NHS has been doing to children now for a number of years has been revealed. As I always say, the Tavistock Clinic for gender-confused children was and still is Frankenstein's castle, where children go to get prescribed life-changing drugs and go to get mutilated. It's unbelievable that this has carried on. So let's get a doctor's perspective on this. Joining us now is GP Dr Dean Eggitt. Did I get that right, Dean? Is it Eggitt? Yes?
It is.
Yes. You did, that's right, yes, thank you.
Well, thank you for joining us. As I say, those of us who are not medically qualified, well, this is what I think. I reckon in 10 years' time, in a generation's time, we're going to look back on the dark years of the Tavistock Clinic and what the NHS was doing to children who turned up and say, I think I might be a boy or a girl, not in the right body. This dark period, we will look back on this agog with what we did to children. We mutilated them. We gave them life-changing drugs. And as Dr Cass said, we had remarkably weak evidence about what effect they might have in the long term. Dean, what the hell has been going on?
It's not unusual for the NHS to try to be proactive and bring medicines to patients as soon as possible. But I am inclined to agree with you in thinking that we were far too soon, in this case, to bring medicines to children to help them with these conditions. Now, let's be fair and balanced here. Gender dysphoria is very real and occurs in children as in adults. So that's not to say that children who are uncertain of their gender are making this up, or that they're mentally unwell and actually they don't have gender dysphoria. They do have gender dysphoria. The question is, how is it best to help them? And I think that's what the Cass report actually outlines. Now, this is a remarkable piece of work, 4 years of work, 388 pages and 32 recommendations, which basically tells us, stop, slow down, go back to the drawing board and decide, is what you're doing right now the best treatment, or should we reconsider a different approach? And quite frankly, I agree. I think we should reconsider a different approach and slow down.
I mean, you say that these children do have gender dysphoria. An element of this report was suggesting that maybe it isn't genuine gender dysphoria. Maybe it's they're presenting with complex issues, autism, bullying, social pressure. You've seen a huge change as well in gender dysphoria largely primarily being a condition, a mental health condition that happens within the male population historically. Then all of a sudden, 75% of those presenting to GIDS were females. And there needs to be questions asked about what has induced this. Many people, there's been a report in America saying many of these kids who think they're gender dysphoric, about 75%, a few years down the line, grow out of it and realise they're not. Do you think these kids are being pressurised by popular culture, by things they're reading online, and rather than being challenged, as you would do someone who was body dysmorphic or anorexic, they've been totally affirmed and sent on medical pathways for a mental condition?
Yeah, I think there are a couple of questions there. So I'm going to try and break it down a little bit, if that's okay. So first of all, do we believe that gender dysphoria is a real thing? Yes, it is a real thing. And I don't think the Cass report says that gender dysphoria doesn't exist and actually it's some other form of mental illness or mental difference from the norm, such as neurodiversity. I think what it's saying is that in some cases where possibly overdiagnosing gender dysphoria because we're failing to overlook other mental health problems such as depression, anxiety, eating disorders, family stresses, or neurodiversity. But that's also not to say that gender dysphoria doesn't exist with these problems. I think what the Cass report is saying is that honestly, we've been too fast to say it's gender dysphoria, let's start some medicines, rather than, okay, let's look at the patient as a whole, understand their life, understand all of their problems, then make a slow, confirmed, rational decision. So does gender dysphoria exist? Yes. Do we need to slow down to make sure we get the diagnosis right? Absolutely. Should we be putting everybody on pills at the first stage? Absolutely not.
I would say that gender dysphoria definitely exists and we should sympathise with all children who suffer from it. But I would say that the number of people who genuinely suffer from gender dysphoria is far less than those who are being told that they do. And to be fair to NHS England, they clearly started to worry because this is 4 years ago. They commissioned this report by Dr Cass. So they obviously said, look, we need to really look at this. But while these doubts were beginning to blossom, if you like, they carried on doing it. And what I'd like to ask you, I know it's not your fault, Dean, but what were grown medically qualified adults doing at the Tavistock Clinic when kids as young as 8 years old turned up and said, I think I'm in the wrong body, and they go, oh yeah, you definitely are. What the hell were they doing? Why didn't they just say, look, go back to the playground and talk to your mum and dad? It was ridiculous.
You've got some really valid questions. I think we as a society need to sit down and ask some of those questions and say, were those at the Tavistock Clinic being overly helpful and trying to get patients onto treatment as soon as possible? Or were they being pushed by society in trying to recognise this as a condition? Or were they recognising that actually other treatments weren't available, support wasn't available, and support for these other mental health problems is not really readily available? So what they were trying to do is reach out to help patients at the earliest stage. Now, personally, I'm going to admit, I think what they were doing in Tavistock was wrong with children. I think they were treating them too early. I think they were diagnosing them too early. And this was being pushed at far too fast a pace, based upon partly a desire to help children, but also some institutionalization and being outside of the norm and no longer recognizing what society is thinking, because I don't think society agrees what was happening with Tavistock either. On behalf of the general medical profession, I as a GP was looking at them thinking, this isn't right, this is not okay. But I think most of us are probably too frightened to speak up, or don't actually have the opportunity to speak up, or when we do speak up, our voice isn't listened to until such a time as now, where we have better evidence from Dr Cass and her team.
But this really gets to the crux of what the perversion of this phenomena has been, which is that it's become not just sort of, normalised that a child can think that they are in the wrong body, but almost promoted. It's not just been a tyranny of silence. There has been active propaganda. There has been a push. It's almost become a badge of honour to turn around and say, I'm bringing up my child without having a gender. I'm not going to put my little boy in blue clothes or my little girl in pink clothes. I'm going to let them change their names. Celebrities all over the place seem to have non-binary kids. This has become some sort of fashion item, and the net result of this is, I think, and I want to know if you agree with this, there have been a great many children trapped up in adults trying to shower themselves in moral virtue and rectitude, who down the line are going to want to sue their teachers and sue their doctors and possibly even sue their government, because about 6 months ago, before this report came out, if you ask someone from either of the political parties if they think kids should be allowed to transition, they probably would have said, oh yes, that's brilliant and that's wonderful and progressive. They wouldn't have had the guts to turn around and say that's probably a bit dodgy.
Certainly, I think harm has probably been done. Now, we can all think of cases with our own families or friends where your little boy is dressed up as a princess at a party, or your little girl has dressed up as Bob the Builder. Now, that's different to gender dysphoria. That's people just experimenting and playing. But believing you're a different gender is a completely different thing. Now, what seems to have happened in society is that little boy who dressed up as a princess, we've now started to say, well, you know what, you probably are a princess. Maybe we should treat you as such. And that has been a societal shift which has put pressure upon children and upon families to adopt that as the identity of the child. Again, we as a society need to discuss that and say, actually, is that the direction we want to go in? Because society does change over time. or we say as a society, actually, that pressure is wrong and we shouldn't be doing that. And actually, I don't think that decision has been made yet. I think we're airing our views here, but as a society, we haven't decided. The important point being, from a medical perspective, is those children who we've taken the time to understand and diagnosed as gender dysphoria get the holistic help that they need rather than popping them on pills straight away. And those children who aren't sure and experimenting and learning, again, we give them that holistic help and support and do not put pressure on them to decide at an early stage, and allow them to get help for any other problems that they may have before making any decision. Decisions take time.
They do. Dean, I wish there were more doctors like you. You exude common sense. Therefore, you will never do well at the NHS. But very good to talk to you. Thank you very much, Dr. Dean Eggitt.